welcome to my channel. My name is Marisa and this is Colin Jr. And I wanted to talk about surviving RSV with a baby and just some tips and tricks from a pediatric nurse and a mama. Okay, to add a disclaimer, I did want to note that this is for educational purposes only. This is not medical advice. If you have any concerns, always talk to your doctor about anything. This is just for education, what I've done and what I've learned being a nurse and working with babies who have RSV and treating my own little boy who has RSV as well. So just kind of backstory. We have probably been sick for about a week and a half now. Unfortunately, I got it as well. I probably brought it home from the hospital. Sometimes it's inevitable. He started by just having a little bit of a cough here and there, and then got really mucusy in his nose, and right now we're still just kind of working through a cough and just like probably just generalized doesn't feel good but can't really tell us. I've never had any temps, anything like that. I did have a day where he was having some retractions, which is when they're pulling they're having a hard time breathing and they're pulling, and you can see like the skin going up under their ribs or even through their ribs. And then you got some work to do, why don't you type away, okay? And so that is when I ended up bringing him to the ER. Before that, I brought him to the doctors and they were like, yeah, he's probably got RSV, we don't even have to test him. Then I brought him to the ER after he had retractions a few days later, and they said that it's likely that he has bronchiolitis, but he's not desatting, he's not, having a hard time working to breathe outside of the retractions, and everything else looks good. So they tested him, they sectioned his little nose, and they found out that he actually has RSV and paraflu. So those are both basically common colds that we as adults get all the time, and that we generally don't even sometimes go into the doctor's office to test. In fact, they usually don't even test adults for RSV, or I'm not sure about paraflu. But, okay, first things first, what are the signs of respiratory distress or just sickness in general that should make you say, hey, I need to go to the ER or I need to call 911? So the very first one is retractions. And I'm going to put a little video for y'all to see a clip of the ones that he was having. Those are a sign that the baby is having to compensate, that the lungs are pulling really hard up through the chest. You can usually see, you'll be able to see their rib, you'll be able to see underneath their rib, and sometimes it gets worse as it goes up, and you'll start to see this part of their neck sink in every time they take a breath. So that's a sign that you need to go to the ER, or if it is generally up any higher, I would suggest just calling 911 if you are concerned. They can put some oxygen on them or whatever needs to be done. The next thing to go to the ER would be if they're having a respiratory rate of 60 breaths per minute or greater. So you're gonna literally count for a whole minute, because babies are funky little breathers, and you want to watch their little belly every time they take a breath. Keep an eye on the clock and then just count for a full minute, because they have variations in breathing. The next thing that would make you want to call 911 is if they are having blueness around their lips, hands, or feet. Those are the first areas that you'll see the body compensate, and lack of blood, and which means lack of oxygen. So The next reason you would want to go to the ER is if they are having low urine output, if they're not making as many diapers as they were making, or if they're just not taking bottles as much as they used to. Like, they could be stuffed up and just not wanting to eat, and it's hard for them. And a big reason that kids have complications when they come into the hospital is dehydration, so you want to make sure that they're getting hydrated. So the other reason you would want to bring them to the ER or call 911 is if your mommy instincts say, hey, something's wrong, I don't feel comfortable, something's wrong, like I need to take care of my baby. So do it. Tip number 1 to help a little baby with RSV is making sure that they are drinking lots of fluids. You want to make sure that they stay hydrated. Even if that means giving them, if you're breastfeeding and you have an extra milk supply, giving them some Pedialyte in a bottle just as something extra to make sure that they're hydrated. Giving them some, always just make sure that you're constantly trying to cue them to eat, even if it's not their scheduled time or whatever. Just if they'll take a bottle, give it to them, let them drink as much as they want, and try again later. So another thing that you can kind of test if you want to, it's not the best judgment, but just to give you an idea, babies, I think up until 6 months, I'll have to check that, have a soft spot on their skull. It's right here on the top of their head. A lot of ways you can tell if they are at the point of dehydration is it'll be sunken. So if you move your hand over it, instead of it being kind of level, you'll feel an indentation, you'll feel the bone, you'll feel the soft spot where it indents, and then you'll feel back the bone again. And that's a sign that they very well are dehydrated. So the next thing that you want to do to help your baby cope with RSV or any kind of little respiratory bug is humidity. So they have a lot of junk in them, and unlike us, they're not able to know to blow their nose or anything, and it can get really thick and clogged up in there. And so you want to just bring them into the shower and let them hang out with you, get it nice and steamy. If you have any essential oils, maybe things that are like eucalyptus or peppermint, things that are make you want to open up the airway and stuff like that, that should help. The next thing that has been a lifesaver for us with RSV is most commonly known as a nose Frida, or I actually bought this off of Amazon. It is just like a generic one, and it comes in this little case back here. And these are all little filters you can pop out. So you stick this part up by their nose, and then you will suck from this end and suck out all the yucky snot. It works so much better than an electric one. Doesn't compare to the hospital version, but it's the best you can get at home. So that has helped us a lot. Also, if you are interested in looking up a saline, oh my goodness, recipe to put little drops down their nose to help soften the mucus, you can do that too. And I think I have a link to a good recipe. The next thing that helps with RSV and colds for babies is, depending on their age, I would say 4 months and up, you can give them elderberry. Make sure it's dosed out for babies. I got the... Wait. It's not your bedtime yet. You just woke up from your nap, huh? What, because I'm not talking to you? You want me to tell you about it? I've given you the elderberry syrup. This is Dr. Green Mom. She has a lot of great products. She's a doctor, and she just wanted to give people some other options besides the typical medicines that are out there that have a lot of can have a lot of negative consequences. And I know. So this is literally purely organic elderberry fruit in vegetable glycerin and deionized water. So I've been giving him about 2.5 milliliters of that once a day. And really this is an awesome... Colin Jr., come see. You want to play with your nose, Frida? This is great for prevention. So if you know, I wish I would have done it. I should have thought about it, but it kind of came up on us quick this season. If you're anticipating everyone's getting a cold, you haven't gotten one yet, go get you some elderberry syrup. You take it too, and have the baby take it, and that'll really help your immune system. I think that maybe giving him this has helped from getting it to progress any worse. All right, the next tip I have is baby probiotic drops. So I was kind of giving him something like this to begin with because we, if you know my other videos, have had a lot of colic issues. But another thing with this is the immune system has a lot to do with our gut. And so if you have good gut bacteria in there, it can help you heal a lot faster. And if you think about it, his chest, like, he's so like jumped up, and when he coughs it up, he's probably swallowing it. And so we want to make sure that his GI has a good army of good bacteria to help combat all the mucus that he is going to be very likely swallowing. So all right. Another thing that you can do at home without having to buy anything that we do in the hospital. No, Yupsy baby, yupsy baby, yupsy baby. Don't put that in your mouth. Okay, another thing we do in the hospital, which I'll show you on him all the time to patients who have respiratory issues, is we do what's called chest physical therapy. And it's just kind of taking, they usually have a little device that they use, but you can also use your hand. You kind of cup your hand, and not too hard, but with, you know, just a good amount. You want to give them little compressions, because this is going to move the mucus around in their chest and in their lungs, and just get it kind of out and away from staying stagnant, and it just helps prevent the worst outcome, which would be pneumonia. So lots of little chest compressions. It probably feels good. Sometimes it'll get them coughing, which is fine. And you can do this like up to 3 times a day. Sometimes in the hospital they'll do it for like a full minute. You just do that to get the mucus moving around. All right, and last but not least, if you are a breastfeeding mama, you want to keep breastfeeding, especially if you are sick too, because you're only going to be transporting, you are going to be giving the antibodies that your body has made through your breast milk to your baby to help them fight it off as well. That's the best thing you can do. It always sounds weird. You want to stay away from your baby when you're sick, but really just practice good hygiene. Wash your hands before you breastfeed or when you're doing anything with baby, and keep breastfeeding, because that's the best way for them to stay healthy and fight it and build up their immune system. And that's really all I have for y'all today. Thanks for watching. I know there's a lot of distraction with little boy here. We're getting close to the fussy hour. If you have any other tips that have really helped y'all out, or any questions, or just whatever input you want to say, leave it in the comments below. If you like this video, like and subscribe to see more just mommy topics, nurse topics, and natural living topics, all kinds of stuff like that. And we'll see you in the next video. Bye!